Hello, listeners. Welcome to Views on Health. Back on the program today is Professor Pujitha Wickremasinghe, Professor of Pediatrics, Faculty of Medicine, University of Colombo, and consultant pediatrician, Lady Ridgeway Hospital in Colombo. The topic that Professor Pujitha Wickremasinghe is going to focus on today is fever management and febrile convulsions. A very common occurrence amongst babies, and without any further ado, babies and children, of course, over to you, Professor, to introduce this very important topic, fever management and febrile convulsions.
Thank you. So actually, fever and febrile convulsions are two common entities that we see in this country. And most of the parents are really scared when their child falls sick, and especially when they have fever. But sometimes, of course, we tend to overreact to the temperature, to the fever, and that could lead to a lot of harm than good to the child. Because what we have to understand is fever is actually a natural process which has come to control the infective agent, maybe a virus, maybe a bacteria which enters into our body. And we need to have certain amount of temperature in the body for some of these other immune mechanisms to function. But however much it happens, it is also discomforting to the child. And then that makes the child not to drink, not to eat, and feel very miserable. So all these things also add on. But the main thing the parents are worried is that they will think the child will get a convulsion and that the convulsion is harmful. Actually, should say at the outset that 99.999% of the convulsions that occur with fever are rather harmless because they will last only for a very short period of time, and they would come out of it on its own without any medication, and the brain damage is almost nil or never heard of. So the important thing is we should understand why does the fever occurs, and then how do we control it, and then we can take it on from there. So when it takes the fever, of course, any child can develop fever when there is an infection, and usually in the first 24 to 48 hours, the children do get a very, very high fever. And for that controls, we are commonly using is paracetamol, and we have to use it in the correct amount. But other medications, sometimes people tend to use it, but it should never be used as a over-the-counter medication. It has to be very carefully given by a medical officer, because what happens is some of these medicines, they can damage the kidneys, they can damage the liver. And sometimes we know that we insert suppositories when the temperature is very high to bring down the temperature. That is well known to cause injuries to the rectal area and cause very, very damaging bleeds. So my main advice is you just stick to the paracetamol. Don't give anything extra. Don't try to overdose them. And don't try to give under-free. It should be given actually within the 6 hours. Once in 6 hours, because sometimes parents tend to give it once in 4 hours also, but the cumulative dose that they take for 24 hours should not exceed more than 4. So the other important thing is that they can sponge the baby. They can take normal lukewarm water or the normal tap water actually, and then you just apply a thin film of water. The whole idea is to get the body heat, absorb that and evaporate the water. Then the other important thing is parents always are worried that the child is not eating, and they think that if he does not eat, he will lose weight. Of course, when they will naturally lose weight after an infection, but of course soon after they have recovered from the infection, they will get a very good appetite and they will regain what they have lost. But the most important thing during a febrile illness is that we should be giving them enough water. So plenty of fluids. It may be pure water, it may be any other drink that they should be given. And that will help to pass fair amount of urine. Then through the respiratory tract they can again pass certain amount of water with the water vapor heated up. So that way will help to bring down the temperature to a great extent. If the child prefers to eat anything, of course they should be fed. There is no need to stop them feeding, and there is no food that should be barred just because the temperature is high. Because people think sometimes it is difficult to digest, but that may be a food item that the child would prefer. And we should not be sort of think about what is nutritious, what is non-nutritious, what is harmful, what is junk, especially during a time of febrile illness, but feed the child. So the most three important factors in order to control the temperature is that to give the correct dose of paracetamol in the correct frequency, then to mop the child with normal tap room temperature water, as well as to give plenty of liquids to drink, plus or minus the food. Food is secondary, but the most important primary thing is to give the fluid. Then of course sometimes the parents, again what they do is they rush to do a blood test, especially in the case of dengue fever. Usually I must categorically say that dengue fever will not cause trouble within the first 48 hours at all. Even the medication or the management, the treatment for dengue fever, if we think in the first 48 hours, is actually giving plenty of fluid. So that is the most important. Even thereafter is fluid management is the cornerstone in successful management of dengue illness. So what the parents should not be actually rushing to do a blood test in the first 48 hours. And if a child needs actually first a blood count in the first 48 hours, that means the child is so ill that he or she should be in a hospital. Then we tend to do the dengue antigen. And my advice and my experience is that best yield of this test would be to do between 24 to 48 hours maximum. So at least wait for about 36 hours before you do it, and always better to get a medical personal advice before you go and prick, because there may be some other tests that they could do also depending on the signs and symptoms child had developed, rather than doing repeated pricks, because that itself is painful as well as it can cause harm as well. So the main thing is that the parents should not panic whenever the child gets fever, because fever per se is not going to harm. And as I said, fever per se will not bring a febrile convulsion, as well as the febrile convulsion is also not a harmful thing to a great extent. But the important thing is to bring down the temperature, make the child comfortable by adequate exposure, giving fluids, and then giving paracetamol and mopping the baby child with room temperature water.
Thank you, Professor. Are you saying that parents can administer paracetamol without a doctor saying do so?
Yes, they can. Only thing is they should know the correct dose. Now, of course, the dose for that you have to know the child's weight. So, of course, periodically, most of the children do get weighed at least once in 2 to 3 months. In the younger age, it's much more frequent. So, they will have a good guess about the weight of the child. So, then the pack contains how many milliliters of that, or the tablet size or whatever, mainly the milliliters, of course, for children, is there. Or in a prior consultation, you would know how much, if it is a child who is taking the tablets, how much of the size of the tablet they should be taking. So based on that, they can give it. So it is a medication, it's a first aid that they can administer at home. But of course, they should not overdose, plus they should not give it at a higher frequency. They should be giving only once in 6 hours. In case if they have to give it in once in 5 hours, then the next dose should be given at least after 7 hours. So, because the whole idea is for 24 hours, you could administer only 4 correct doses. Otherwise, it can cause harm to the liver.
Thank you for that piece of advice, because I'm sure parents listening in, young parents especially, would be able to handle this situation when their babies do fall ill. Going on to the convulsions, at what point in time does this happen, Professor? Because that from a lay perspective again can be very worrying, and one would tend to panic. Though you say don't panic, but the natural tendency is to panic and then rush a child to the doctor. So what would you advise in that situation?
I know it's easier said than done. So, but of course, the important thing is why I said this, that not to panic, is because sometimes panic brings very disastrous consequences. So usually these febrile convulsions do occur within the first 48 hours of the febrile illness. And we commonly see it between 6 months to 6 years of age. And of course we do tend to see outside that period, but commonly during this period. And most of the children will have maybe about 1 or 2 febrile convulsions at all, and then they will just wane off on its own. So in the first 48 hours, as I said, and most of them will have a family history. Either they are sibling or parents as childhood, during their childhood they would have had it, or it could be a close relative like a first cousin or a second cousin. So that way it is rather predictable to some extent when they have it. So actually that group is the one who is actually tend to get to panic so much and then tend to do the wrong thing. So once the child develops a convulsion, the immediate thing, the whole thing is, as I said earlier also, the convulsion, the damage done by the convulsion is very minimum, because it does not interfere with the brain's blood circulation, it does not cause any other harm, and it most of the time would last less than 5 minutes, and they recover on their own. So, but what really happens is the way we handle sometimes, because the child becomes unconscious, any secretions in the mouth can seep into the lungs. Then of course that can tend to cause a pneumonia. If it is so severe, it can even lead up to a lung abscess. So that is what we have to prevent. So no sooner we see that the child has developed a convulsion, immediately lie the child on the floor and turn to a side, maybe on the bed or wherever you are. Then turn to a side. The whole idea is to keep the mouth directed towards the ground, and gravity will take away all the secretions away rather than letting them go into the chest. So that is the whole thing. So that's why whenever the child gets a convulsion, we should not be carrying the child upright. We have to keep them horizontal with a head low position, and then if we have to take to the hospital, take. So immediately when the child develops the convulsion, lie the child on the floor, turn to a side, and then call for help. So when the help arrives, see whether there is a vehicle. If the vehicle is there, still the child is fitting, then carry the child in the same manner with a slightly head low position and take to the hospital. But by the time the help arrives, then of course if the child is up and back to almost normal, then of course you don't have to panic. But if this has been the first episode, and if you want to get certain more advice as well as make sure that there is nothing sinister, then of course first episode admit into a hospital and keeping under observation, mainly purely to gain confidence to the parent and see. And we don't know, sometimes some of the children, a minority, will develop 3-4 convulsions within the one febrile illness. So then they may get really panic. So my advice is, first convulsion, it would be better to get admitted to a hospital, and then subsequently of course parents will be empowered enough to manage them at home.
Thank you, Professor. At what point in time of a baby's life, born few months, can one expect a convulsion with the fever?
Usually after 6 months of life, and usually after 6 years, they usually disappear.
Professor, you say that after 6 months that it can happen, but for 6 months it's very unlikely.
Very unlikely.
And then 6 years?
After 6 years, again very unlikely. But in medicine, of course, there is nothing absolute. It can drain down. But usually the identified period is 6 months to 6 years maximum.
So what is the treatment?
There is no particular treatment. We don't give any medication. That's a good question actually. Because parents sometimes tend to ask, okay, now what should we take any medicine? Because this, as I said, it comes with a febrile illness, and then it has never been identified causing any damage to the brain. And medication-wise, convulsion medications, anticonvulsions should be given at least for about 2 years' time. And anticonvulsion have much more side effects and could cause damage to the growing brain, especially behavior problems, learning difficulties, than the simple febrile convulsion that occurs. So because of that, not a pediatrician, not a neurologist will ever prescribe any long-term medication for pure and simple febrile convulsions. So there is nothing to worry. That's why very confidently we say, don't panic, don't worry. The child will not get any brain damages because of this. But rarely there can be certain cases who are inherently having epilepsy destined to develop seizures, that is epilepsy. They can initially develop the epilepsy because precipitated by the fever. So in those cases, of course, once they have the features, if they keep on recurring, that's why I said febrile convulsions rarely recur, or they would recur maximum about 3 times. But if there is recurrence beyond that, then of course we will tend, and looking at the nature of the seizure, then we will tend to do other investigations like EEGs, other examinations, and if it warrants, then of course it will not be febrile convulsion. So it will be a epilepsy syndrome. Then of course that has to be treated separately. But for febrile convulsions, we don't tend to give medications on a long-term basis because it does not warrant.
So that's once you diagnose what it is.
Yeah.
Whichever way, then you treat it accordingly.
Yes. So if it's febrile convulsions, no treatment is required.
But if it's epilepsy?
If it's epilepsy, then of course it has to be treated accordingly.
And if it, just now that we're on the topic of epilepsy, now that I'm going into it in detail, if that does happen, I mean, it's identified, you diagnose it as epilepsy, does that happen within that first 6 months and then going to up to 6 years? Or?
Well, epilepsy of course can occur from day 1 going up to day 99 or year 99 till your entire life. It can occur at different stages. Now childhood epilepsy is something because they were born with a certain, maybe a scar in the brain, maybe a birth injury precipitated, maybe meningitis they develop later, or encephalitis develop later, something like that. Or in the adulthood it can be a bleed or whatever like that, or in any other injury. So there can be a long list of causes and long list of reasons for them to develop epilepsy. But when it comes to febrile convulsions, we are not very well aware about the etiology, how it happens. But what we know for sure is that it has a family history. Majority, I would say 95% has a clear family history. Then it is a very short-lasting seizure disorder or convulsions. And more than 99.9%, they don't have any residual damage to the brain. No learning difficulties, no behavior problems, no structural abnormalities, nothing. So because of that, it is totally within quotes, of course, I would say it's a benign condition, but of course it is not benign when it comes to a parent's perspective, because any convulsion you don't know. When it's a convulsion, it's a convulsion. You don't know whether this is going to last for another 2 hours or whether this is going to last for another 2 minutes or 2 seconds. So we have to attend to the convulsion as it is going to be there. So then you take the precautions, you do the first aid, turn to the side, don't put anything into the mouth, don't try to feed the child at that time, call for help. If the convulsion is still there and it's the first convulsion anyway, take to the hospital. If it is a subsequent convulsion, second or third or whatever, where the parents know, okay, this is febrile convulsion, very unlikely going to go long last, but in another minute or 2 it will recover. The vehicle or whatever help comes and the child sits up back to normal, then of course you can just stay back at home and observe and treat the fever, and then based on the progression of the fever, if it is more than 48 hours, then get medical attention and sort out the temperature. What is the reason for the fever? It may be a respiratory tract infection, it may be a diarrhea, whatever it is. But the febrile convulsion actually does not need any continued medication. Even if they had febrile convulsion, say this is the first episode of the fever has occurred, they develop convulsion, still we hardly give any anticonvulsion medication even for that particular episode.
Professor, I don't know if this is a fair question being posed to you, but with today's lifestyle where both parents work, they're professionals or out of for other reasons, to make ends meet, it's not easy. So then the child is left, if not a family member like a grandparent, but there is a maid, or they are left with daycare at daycare centers. In that situation, what would you advise parents to do? I mean, tell the caretaker, I mean the caregiver rather, I mean of the child, this is what you should do or what you shouldn't do. Could you just
well, I think the same first
that.
aid should be educated, whoever looks after the child. And especially I think if the child is in a daycare, probably the child is protected to a great extent, because there would be qualified people and they should be actually, I think daycare centers should be empowered on how to manage febrile illness, febrile convulsion, diarrheal episode, that type of vomiting, that type of things. So I think if the child is actually in a daycare center, of course, then the child is really better off. But of course, if it is a maid, that we have to make sure in this time and era, as much as the both parents are working, there would be sort of some form of communication methods also. So when in the morning, if the parents notice that the child is having fever, or even in the middle of the day the child develops fever, I think the medication and what should be done, what should not be done, should be clearly told to the parents. So I mean, as I advised on how a parent should be managing the temperature, I think the same advice they should be also giving. Then of course the parents should be easily contactable, or even if the parents is not contactable, in this country of course the neighborhoods are fairly good. Most of them should be relying on that. So if the parents can stay back if your child is ill in the morning, well and good, but that is not always practical. No? So I think the main thing is that the person who is looking after the child should be empowered how to look after. If there is any doubt about that person's ability, I think then of course better to keep the child in a safer place. Not in a hospital definitely, but there could be some other relative or a friend, or at least alert a neighborhood just to supervise them from time to time and make help, and as well as have a mode where they can easily access the parents or any other, even because as I said earlier also, the ambulance service is now fairly well developed in this country also, so they should be able to get. So I think those are the main things what we should be doing whenever a child falls ill and if you have to leave them at home.
Thank you, Professor. Once again, time has caught up with us, and time seems to fly when we get into an interesting discussion and go from point to point, trying to explain you actually the professional on the other side of me, trying to explain to our listeners on a given topic. Having said that, I just need to one question that I should have asked you earlier, but I'd like to ask even now. How common is this condition? You spoke of febrile convulsions coming down the line, so to speak. That apart, and even the management of fever, you have also explained. But how common are these fevers and the convulsions that accompany in certain cases in Sri Lanka?
So febrile convulsion, roughly about 5% of the children tend to get them. So it is actually, so we can't say it's an uncommon entity. It is a fairly common entity, and most of the time it is very clearly seen in the family tree. It comes from the parents to the children, or the grandparents to their children, and like that. So febrile convulsions is not uncommon. So I would say roughly about 5% of the population tend to develop it. But of course, they going on to develop repeated convulsions is also maybe about 50 to 60% of them. And then having said that, the numbers who will go on to develop epilepsy syndrome would be less than 5% of that lot. So majority of the febrile convulsions are rather harmless. They would last only 1 or 2 episodes maximum, and then they recover without any complications. So that way, I think people, that's why I said right from the beginning, it is a scary experience, but of course it does not leave much scars behind and get better with the time passes by.
That's a comforting note on which we can end this discussion. Thank you so much, Professor, once again for being with us on the program and sharing your expert knowledge on fever management and febrile convulsions.
Thank you.
We place on record, as always, our grateful thanks to Professor Pujitha Wickremasinghe, Professor of Pediatrics, Faculty of Medicine, University of Colombo, and consultant pediatrician, Lady Ridgeway Hospital in Colombo. Thank you very much for being with us on the program and sharing your expert knowledge with our listeners. Truly appreciate it, Professor.
It's my pleasure.
Thank you also to Damayanti Kolambage for technical assistance. I'm Fatima Razi Kader, saying good night and looking forward to catch you next Monday, same time on Views on Health.